I'm nervous, I'm anxious, I'm excited, I'm optimistic, and but then there's a part of me that's afraid that I'll get there and they'll say, no, they really can't do anything further, and I know it's going to be an emotional roller coaster.
The mission of the Boston Foundation for Sight is to restore the lives of patients who are severely disabled by corneal diseases.
Thank you. Hi, nice to meet you.
Nice to meet you too.
This past summer, I was on a medication for 16 days and noticed a rash. By late that evening, I was covered in blisters everywhere, in my mouth, down my throat, everywhere. So I went to the emergency room and they diagnosed me with Stevens-Johnson syndrome. Yeah.
Stevens-Johnson syndrome is a terrible disease. Those that survive, the edge of their lids become like sandpaper, and abnormal lashes grow into their eyes, and their eyes are dry. And so you can imagine, every time they blink, it's like steel wool rubbing over their corneas, the most sensitive tissue in the body.
I stay home most of the time because of my eyesight. Is this definitely true? Yeah. You okay?
Yeah.
Do you need a tissue? Thank you. I know it's hard to talk about this.
I was devastated, mostly because I have 2 young boys at home, and I had just started a brand new career. So then I thought, oh, this whole dream is going to go away. So I knew I didn't want to have surgery if I didn't have to. I'd been in the hospital, I'd done that, I didn't want to do that again. And so I did some research on my own and found the Boston Foundation for Sight.
By creating this liquid bandage over the cornea and protecting them from the lids, the sandpaper lids, and the dry eyes, it's really the only thing that can help them, and we change their lives.
Hi.
Hello.
Hold on for us here. I'm Alan Kwok, one
Hi.
of the doctors here.
Nice to meet you. I'm Kendra.
Wink. I'm going to put in the lens, the scleral lens. So if you could tuck your chin in and lean forward, perfect, just like that. I'm just going to roll your eyes down. I'm going to grab your upper lid and just keep looking down. Good.
And at first,
Are you okay?
I didn't know what to think because
Okay,
he
let me
put
put
the
it in
lens in my right eye, which is one that I'd been able to see through well enough anyway. And I thought, wow, I can see. And I thought, well, but I could see before. But then I had to think, wait a minute, I'm not in any pain. And then he put the left lens in. Oh my gosh.
Oh my gosh, what?
I can see it.
You can?
It's really clear.
In the right eye?
Like really clear. Like I thought it was clear with the regular lens, but I didn't have the white spot that I had constantly had to try and look through, which is scar tissue in my eye. I didn't have to try and look through that. It was gone. It means that I'm going to be able to take my kids to school. I'm going to be able to drive. I'm going to be able to go back to work and do hair, which is what I love to do.
I decided that it was going to be nonprofit, that it was never going to turn away anyone because of inability to pay.
And my goal is to ask everyone who's touched by this story in my experience to give back something financially if they can.
To be able to do what we do, well, what better thing can you do in life, especially, as the physician?